NMN? What source do you use? What sources are out there? Because I remember when Tony Robbins and I were writing our book, Life Force, when we looked at this, a lot of the NMN sources were not reputable out there. And then, of course, a lot of companies have stopped putting NMN out for sale because of what's going on with Metro Biotech and the idea of having NMN become a medicine versus a supplement. So
Right.
Give us some knowledge there.
Well, the first is about NMN as a supplement on, can you trust it? And, I'm not in the business of testing products. That's not what I do. But I do test NMN sources when I give it to mice. And we have a study that we're just revising showing NMN extends lifespan, mostly in female mice, but it did improve frailty and a lot of health-related things. So we do test NMN, and we've tested a bunch of them. And we find that there are things in there that you wouldn't want in there, like endotoxin, which is highly inflammatory parts of bacteria. And so if you're going to...
Have you published that data?
No, I won't. It's only...
it's inflammatory.
Would we might publish it,
I mean,
actually.
it's super useful
for maybe
folks
you're
to
right.
have.
We should do that.
I mean, somebody should be... Well, listen, you've made NMN a household name. I guarantee the number of people, well, whether you like it or not, because you talked about the value of this. You didn't do it to try and sell NMN. You did this because you're talking about its impact on increasing NAD levels intracellularly.
And I haven't made any money off it. In fact, I've invested a lot of money into clinical trials. No, I mean, there's been like $30 million worth of my money and others to do clinical trials to test a version of NMN in humans. So it's cost me a lot to try and validate NMN as a molecule.
I mean, one of the advantages, if Metro Biotech has a particular crystallized NMN that they're testing in a wide range of medical conditions, right?
That's right. And I don't see why that they can't exist in the same universe, that supplements, which are not under FDA approval usually, they're not prescribed by doctors, but there's an ultra-pure pharmaceutical grade crystalline stable form that has been shown to work that can be prescribed. That's been shown even for fish oil. GSK, actually, our friends at GSK made a fish oil. I think it's still available on the market.
It's a pharmaceutical. It's a drug.
Yeah. And
because
so
of its purity.
Works. Yeah.
And so, but the reason I would use the Metro Biotech NMN if and when it becomes approved as a drug is because I'm assured of quality and purity.
That's right.
Yeah.
And then to get to the FDA thing, I see on social media people accusing me of being the one to take it off the market. That's absolutely not true. I think everybody should have access to it. Otherwise, why would I talk about it?
Yeah.
I do think, though, that there should be some better regulation on how pure this stuff is, because there was a study that showed that I think it was roughly half of them didn't have what was on the label, which is a problem.
And it degrades over time.
Yeah, exactly.
In the non-crystalline form.
Exactly. But what actually happened? I'll explain what actually happened.
Please.
So Metro Biotech, it's not my company. I've invested in it, and there's a chairman and a board. And so they made the decision that they would support the FDA in looking at NMN as a supplement. And there's a law that says if you're using a molecule in clinical trials, it shouldn't be sold as a supplement.
Mm-hmm.
To protect the $30 million investment that the people are putting in, I believe I'm on record. I'll say here that I was not in favor of that. I didn't want Metro Biotech to get involved with the FDA. That was not my decision. But I don't run that company. There are very few companies that I actually have 100% control over. But I am learning that it's better to have control of a company that you're the figurehead of.
Yeah.
But in this case, I couldn't stop that. But I think where we're at now is that there's some gray zone about whether you can sell it now.
I'm seeing NMN for sale.
Yeah.
Let me clarify something. So ultimately, what you're trying to do is raise your intracellular NAD plus levels, your NAD levels. That's the end goal.
And the sirtuins need that NAD to work.
It's the powerhouse.
Yeah.
So NMN can cross the cell membrane and inside the cell gets converted to NAD, correct?
Yeah. Academics will argue over everything. I don't think it's still 100% agreed upon as to how NAD is made from NMN. There's some
Really?
work by Shinamai at Washington University that there's a transporter even high up in the gut that absorbs it into cells and through the gut membrane. But there are people who say, oh, NMN has to be broken down first before it gets into NAD.
And then there's NR, nicotinamide riboside,
which is what's used to make NMN in the cell.
Right. And so you have this sequence. So some people are arguing that you should take NR. Some people are arguing to take NMN. Other folks are doing, NAD IVs. And am I wrong in believing that an NAD IV is not getting into your cell?
Oh, I think that NAD drips will raise the intracellular NAD, probably because it gets broken down and then
gets reabsorbed.
Yeah, but the unfortunate thing with NAD drips, even though they're very popular, is that we still rely on anecdotal evidence that they do something. And I would love to see some more studies on that. But what I can say about oral NMN, we have spent money studying that. And when I say we, the scientists that conducted the study, and I was one of the middle authors on that, have shown that NMN in small groups of people improves blood pressure and cholesterol and lipids, and even seems like it works on strength and endurance. So, in terms of living up to what we saw in mice, it is looking promising. And there are at least 5 clinical trials at Metro Biotech now looking at whether it's efficacious in a disease state.
Yeah.
Alzheimer's, kidney function. It's all on the website. And so with 5 and hopefully 6 shots on goal, the idea is that one of those will work. The other thing that's interesting is there's a new molecule that they
saw that. So MIB 626 was the old molecule.
Yeah, 626 is my birthday, by the way.
Ah, that's where it came from. Interesting.
Yeah, and then 725.
So almost happy birthday.
Thank you. So 725 is the new molecule, MIB 725. And that's the birthday of Anthony Sarve, my great colleague who passed away during COVID. And he was at Cornell, but we miss him dearly. And so that, hopefully if that makes it onto the market, it'll be his legacy.
By the way, NMN, 1 gram.
That's what I take.
Is there any, if you do 2 grams or 3 grams, is there a problem with going more than 1 gram that you know of?
Well,
I'm just curious.
Well, I always like to
I have it in a bunch of supplements, so I'm like,
yeah. Well, it's published that both 1 gram and 2 gram have benefits, and that 1 gram will double your NAD and 2 grams will roughly triple it on average. But in my personal opinion now, I don't think it makes sense to go any higher. Your body will just pee it out anyway, and there's no point taking the risk. But I know 1 gram and 2 grams seem to be safe in short-term human clinical trials.
Got it.